What if I told you that it is near impossible to cause permanent damage to your wrists and hands from repetitive activities, and that you don't need to worry about injuring or making your problem worse with exercise? Today, I wanted to share our 10 years of clinical experience treating RSI and the current research to help you understand that most issues caused by repetitive activities are reversible and can always be treated. My goal is to help reduce any fear you might have associated with the pain you might be feeling with both your exercises and your activities, whether it be typing, gaming, clicking, piano, guitar, anything that you do on a regular basis. Now let's start with some of the science and physiology around repetitive movements and tissue adaptations. Our bodies have the ability to adapt and strengthen with repeated use, provided the load is within what the tissues can handle. Think of going to the gym. When you perform the right sets, reps, and weight, you can achieve certain physiologic outcomes: strength, power, flexibility, endurance. When you are strong, you can lift heavier things. When you improve your speed, you can move faster. When you improve your endurance, you can do things for a longer period of time. Repetitive activities, mayhaps? This is the law of specificity and general adaptation syndrome. Countless studies have been done that showcase our ability to improve our bodies based on the stress that's applied onto it. Now, in most cases, when we are looking at repetitive strain injuries, we're looking at small, low loads that don't involve lifting these heavy weights. RSI occurs when our bodies are unable to handle the stress that's applied onto it. It's the same idea as if an elevator has a certain weight capacity. It can only handle so much before the tendons get strained, and repeated strain can really cause danger to those tendons or cables. Now, for repetitive strain injuries of the wrist and hand, we are using our muscles and tendons to control the movement of our hands. These are the tissues that need to have the appropriate level of endurance or capacity. And the nerves, yes, can sometimes be irritated based on the position or local pressure from swelling. But the main problem is always associated with these contractile tissues, the muscles and tendons that we are directly using and are responsible for the movement. And if the demand in the form of repeated physical activities exceeds the capacity, how much our muscles and tendons can handle, you strain your tissues. And most commonly, it's the tendons when the pain is closer to the wrist or elbow joints, because that's where the tendons are. Now, one of the most common questions we get is, well, what happens when the tendons become damaged or pathological? Is it reversible, or do we have to address this? No, and we know this due to all of the tendinopathy research done by the Doc and Cook Rio group. Our current model of understanding tendon injuries is that it involves a continuum, and based on the amount of stress that's applied onto the tendon, it can move up and down the spectrum. And the best part about understanding the continuum and the research is that even in a degenerative tendon, there's actually more healthy tissue in the tendon than pathological tissue. It swells and there's pathological tissue here, but a lot more healthy tissue, which is why they say treat the donut, not the hole. And this means you can still safely use your wrists and hands without fear of ever making it worse. And I know this may be hard to believe because you're going to be going through these different stages of the continuum and experiencing pain. But what's also important to recognize from decades of pain science research is that pain doesn't tell us the state of the tissues. It's always about protection. And I'll touch on that more in depth later in this video, but if you're interested, you can check out some of the articles that I've written in depth in the description. I do want to highlight a bit more about reactive tendinopathy because it can help many of you understand why there may be some nerve symptoms. When we start to load our tendons too much, it can create a short-term inflammatory response that causes the tendon to thicken. Water and proteins enter that tendon, and the part of the tendon that is irritated then takes less stress while the more healthy part begins to take more load. We call this stress shielding. And during this phase, no tearing actually occurs and there's no disorganization at the tendon. And if we keep pushing, it can actually cause more changes to the tendon that reduce its ability to handle stress. But that swelling can put pressure on the local nerves. Or you can modify the load at this point so that the thickened portions can calm down while also building capacity through the exercises for the healthy portions. And this allows you to get back to activity more quickly. Hey, I know it's not always easy to figure out how exactly to modify your load, how much exercise you need to do, how to progress, how to regress. And you're probably here because your doctor didn't really give you any clear answers or an understanding of why these things can help. If you're looking for a better system or approach for your recovery and you want to know if we're the right fit for you, please book a call in the description below. We're offering free consultations. See you soon. Now, what about these psychosocial factors that influence our pain experience? How do these factor into the idea that RSI can lead to permanent damage? What actually happens when we go to our doctors? Think about it. We're told to rest, brace, take medications, otherwise injections and surgery will be needed. And the underlying assumption is that with resting and bracing, if we do more, it can damage it more. And when our patients are told that surgery is the final option, they often associate it with permanence or permanent damage. This is far from reality and actually has harmful consequences in our confidence in using our hands. It also doesn't help when we go to communities who buy into this traditional approach without thinking deeply or critically. These harmful beliefs are often reinforced through these scary posts that we read on Reddit, Google, e-commerce ads trying to sell products without being informed about the actual research. And hopefully you can see the problem with this. But we now know that when we avoid loading our tendons, it can actually weaken the structure. And the larger problem is that fear often develops as a result of following these recommendations. And modern pain science has shown it's a combination of these beliefs, poor self-efficacy, and the real physiologic deficits that often lead to an issue becoming more chronic or more disabling. When we're afraid of movement, catastrophize, and adopt these harmful pain-related beliefs, there are real physiologic changes that occur in our body that can cause pain to feel worse. We're never saying that it's just in your head. What you believe matters. If you interpret pain as a sign of serious harm, likely influenced by these traditional healthcare providers and what you read on outdated resources online, you can become fearful of movement and avoid activity, and that can lead to those, again, real nervous and immune system changes that can cause the pain to feel much worse. And it can also cause this common cycle of disuse, where you rest, brace, and then when you return to activity, you can feel really sensitive, and then you feel disabled again, and that cycle repeats itself. So again, think deeply about your last doctor's visit. Did they help you understand your problem more thoroughly and why the solution will actually provide long-term relief? Or did they just tell you to stop what you did to cause the pain and rest or brace? Now, how do you think this affects your self-efficacy or your belief in your ability to use your wrists and hands for certain activity? Now, on the other hand, individuals who do maintain a positive and realistic understanding of their pain stay active within tolerable limits, and they usually recover without long-term problems. And this is why I wanted to create this video, since this has been such a common fear amongst our patients. And once this is deeply understood, faster progress can be made. And I get it. This can be hard to believe when everything that we're exposed to is inundated with previous methodologies and approaches that often create fear. But again, decades of research into pain have continued to show that these cognitive and emotional factors have a real impact on our pain experience, and that learning more about it can help you make better decisions about what you can or can't do. So remember, pain does not always equal harm. Let's get back to the main question though. Can RSI cause permanent damage? If most RSI starts out as reactive tendon irritation or muscle strain based on the specific muscles that are being used, this is reversible. But if you continue to push it and it gets to the degenerative state, this is actually extremely rare for wrist and hand issues. It's actually still treatable and doesn't lead to permanent dysfunction. Again, as we mentioned, because there's more healthy tendon tissue than pathological tissue. Often the reason why this is so rare is because that cognitive emotional aspect and the interventions from traditional healthcare get in the way of the tendon getting to this degenerative state. Most of you who are watching this may have had an MRI or other imaging that probably found limited to no issue of the tendons, which again supports what we often see. But what if the nerve gets irritated as you continue to utilize it? This is something that I believe most patients fear because of what they have been told or seen online. But guess what? Peripheral nerves, which are nerves outside of the spinal cord and brain, always regenerate and heal. This is something we have known for decades. There are, of course, degrees of nerve injury: neuropraxia, axonotmesis, and neuromesis. Neuropraxia is the mildest injury, where the nerve is stunned but intact, and recovery is typically complete within 6 to 12 weeks with rest. Typically, there needs to be some trauma that occurs. Axonotmesis is partial nerve injury where the outer sheath remains intact, but the axons within are damaged. And regeneration occurs approximately at 1 millimeter per day. Neurotmesis, which is complete nerve injury where the nerve sheath and the axons are severed, surgical repair is almost always necessary, especially for gaps larger than 2 centimeters. But unless there's a machete that flies out of your ceiling shooting towards your wrist while you're performing these small repetitive movements with relative load of 3 to 7% of your body weight, that's with like typing, crafting, piano, gaming, clicking, then it's extremely rare for a complete severance to occur. Most of the nerve pressure is temporary from the local changes of the tendon that might put pressure on it. And we're not moving so quickly with so much force that our nerves tear. It's actually impossible for the pressure from the local swelling or increased thickness of the tendons to cause the nerve to be severed or just cut, leading to permanent damage. Now, hopefully you can see now that there's very, very few, almost impossible situations in which the tissues at your wrist and hand can be permanently damaged as a result of repetitive activities. Now, what can you actually do? Here's what helped our patients the most. The number one thing you can recognize is that when you are performing your exercises using your hands with small repetitive movements and you feel pain, whether it be sharpness, discomfort, weakness, and tingling, at worst you may have actually irritated the tissue with the cumulative amount of physical stress that you performed on the day and the day prior through your daily work and functional activities. Think the amount of typing, wrist and hand use that you performed on that day, and the exercises you've also performed, what you've attempted in terms of sets, reps, weight, the amount of rest between the exercises, and when you perform them during the day. All of that exceeded what your tissue could handle. And again, you'd have to account for what you did on that day. And this represents the real physiologic limit of your wrist and hand tissues, your muscles and tendons. And that's pain that is sharp more than 5 to 6 out of 10 during your activity and stops you from continuing to physically perform that activity. And this pain will stay elevated for the rest of the day into the next. It's not just the elevation of pain, but you're physically less able to use your wrist and hand due to more sharp pain or excessive fatigue. And keep in mind, many times people stop because they're afraid of this, not because it actually reaches a level where their tissues are flared up or it is unable to be used. You can really reduce the duration of your flare-up or tissue irritation with a better understanding of pain and the physiology of RSI. You can check out the full flare-up guide video right over here. And at best, you have figured out the exact amount of physical stress you can handle based on these same variables. And this is powerful to know, because then you have real data in terms of how much you're using your hands, plus the exercise prescription that led to exceeding what your wrist and hand can handle. And then you can use that to safely limit or modify your activities to the right amount and intensity. And while you're focused on modifying your activities, you can hopefully work with a physical therapist on the exercise response so you can gradually build up your tissue capacity over time. That means finding the right approach to modify the exercise so you can still build your tissue capacity. And again, I decided to create this video because this was an aha moment for many of my patients. And from there, it's more about working collaboratively to find that real physiologic limit and considering those psychosocial factors that may be causing fear of movement or sensitized pain. Now, to summarize, most RSI injuries cannot lead to long-term permanent dysfunction. Understanding the physiology around RSI and how our beliefs influence our pain experience will help you resolve your problem more quickly. And the best treatment is one that considers both your physiology and psychosocial factors. If you want to learn more about some of the physiology of RSI, check out this video right over here.